Hi, my name is Bob Filner. I'm Congressman from San Diego, California, California's 51st Congressional District, which includes all of the border with Mexico. I thank you for this opportunity of telling you why I'm in favor of a robust public health insurance option, similar to Medicare, being offered alongside all the private plans that are open in America. In fact, I think a bumper sticker we should have is Medicare for all. This will increase America's choices for health care coverage. It'll be open to everyone, regardless of income, health status, race, employment, or gender. It'll provide affordable, high-quality, and accessible health care for all Americans. And they will be able to choose what doctor to go to. This does not eliminate choice. This promotes choice, in fact, for all Americans. We will have competition with private plans and lower insurance costs for everyone. I think it's very ironic that the people who are against the private or the public plan say it'll destroy the private plans. These are the same people that say government can't do anything. Now all of a sudden government's going to have such an efficient system that will put these guys out of business. I think that's a pretty ironic statement. So we want a public plan that makes sure everybody gets coverage for their health insurance. That will bring down the cost for the whole society. When people have insurance, they will be able to get preventive care. They will be able to get things like dietary information. They will be able to stay with a primary physician and stay out of the emergency room, which is really what increases costs for everybody. In my district in California, there are 150,000 uninsured individuals, 21% of my district, and 97% of them will be covered under the plans that have been discussed in the Congress. If we do that, that's almost 130,000 more people will be covered in my district. So for me, it's a no-brainer. We have to have a public option so the people who are uninsured have high-quality options, affordable options, and they will be able, in fact, to lower the cost for all Americans in their healthcare system. I've heard some compromises being put together which says we will not have a public plan unless there's a certain trigger, a trigger based on the number of people, I guess, insured and various costs involved. That's a recipe for no public option. We need the guarantee of accessibility on day one, and any trigger, as far as I'm concerned, kills my support for the bill. We need to do this now. People say we're rushing it. We've been waiting since 1948 for taking health care reform seriously. We can't afford much longer at this rate. We'll have choice, we'll have coverage, we'll have higher health for all Americans. So let's get the public health option, and I am not going to vote for any health care reform plan that does not include such a public option. I want to say something of politics for all Democracy for America members. We had a great election last November. We elected a great president, Mr. Obama. We elected Democratic majorities in the House and the Senate. But you can't just sit back and wait for us to do the job. The force of reaction, the forces of inertia, the forces of the status quo are very strong. You need to keep active. Don't just wait for us to do it. If necessary, in the streets, we have to demand health care reform because the folks against it are going to put everything they have against it because they lose their profits. It's that simple. It's time for DFA to be back into action and on the streets.